Okay, picture this. It's the 14th century. Europe is absolutely reeling from the Black Death. I mean, this disease wiped out maybe half the population. We always hear these stories of just chaos, right? Superstition, pure fear, people blaming strange things like bad air or the stars, just helplessness. But what if that wasn't the whole story? What if elsewhere the response was, well, different, more organized? Today, we're doing a deep dive looking at some insights from Islamic plague doctors, quarantine before the West. And this perspective, it really challenges that standard narrative. We're going to dig into a piece of history that often gets overlooked, and honestly, it might surprise you.
Yeah, exactly. Our goal here is to see how cities in the Islamic world like Damascus or Cairo tackled pandemics. And, they used methods that actually came before what was happening in Europe and in some ways were maybe even more advanced for the time. We'll be exploring these early public health ideas, which were often tied into wisdom that was centuries old already. It's a really remarkable story of dealing with a global disaster.
Right, right. So the big question is, well, parts of Europe were maybe struggling with superstition. What did the Islamic world have? What tools? What understanding? And we'll unpack how things like quarantine or the idea behind it and a pretty sophisticated grasp of public health were already happening way before modern science as we know it. Okay, so let's get into these origins.
Yeah.
Because it wasn't just doctors reacting on the fly during the crisis, was it? You're saying the roots go way back.
Absolutely. That's what's so fascinating. This wasn't, invented in the 14th century out of sheer panic. It actually traces back to the 7th century, to the words of the Prophet Muhammad himself. There's a saying recorded in Sahih Bukhari, which is a really important collection of his teachings, the Hadith. And it says, if you hear of a plague in a land, do not go to it. If it breaks out in a land while you are in it, do not leave it. And this wasn't just like spiritual advice. I mean, it had that layer for sure. But Muslim scholars, doctors, when the Black Death hit centuries later, they actually looked back at this. They used it practically. It became a real guiding principle for how to act, an ethical framework, but also, very pragmatic. It was already there.
Wow. So like a 7th century pandemic plan guiding a 14th century response. Just think about that for a second. Having that kind of foundational idea woven into society for hundreds of years, how that could change the way a whole community reacts compared to maybe just improvising based on fear. It's a totally different starting point, isn't it?
It really is.
But we should be clear, even with these principles, the Black Death still hit the Islamic world incredibly hard. It arrived like everywhere else, through trade, maybe conflict. The devastation was immense.
Oh, absolutely. The death tolls were just staggering. You look at Cairo estimates, are around 200,000 people lost. In Damascus, at the peak, they were burying something like 2,400 people a day. Yeah. And cities across Persia, North Africa, they suffered huge losses too. It was a global disaster, no question. The Islamic world definitely felt its power.
Okay, so the impact was devastating everywhere. But you're saying the response, especially in a place like Damascus, was noticeably different. What did people writing at the time, like Ibn Battuta or Ibn Kathir, actually record? What did they see?
Right. This is where the historical sources get really interesting. So 1348, the plague reaches Damascus. What happens? Well, the city basically closes its gates. Caravan routes suspended. That cuts off a lot of the travel and trade. Even the pilgrimage to Mecca, which is obviously hugely important, was restricted.
A major step.
Huge. And public prayers, they still happen, but, and this is key, they move them to open spaces, away from crowded mosques. People were also told, pretty clearly, stay home. And they rapidly but methodically expanded the graveyards to cope. It was a coordinated, citywide reaction.
That sounds systematic.
Right.
Closing gates, stopping travel, telling people to stay home. That's a far cry from the image of pure chaos we sometimes get.
Yeah.
How did that coordination actually work on the ground? What made it different?
Well, it seems to have been a combination of things that were already in place. They had these hospitals by mare stands, which were used to separate the sick. That was crucial. And you had religious leaders, the clerics, working together with doctors. They organized burial teams, set up isolation areas, even gave sermons about why these public health measures were important. It wasn't a lockdown like we think of today, obviously. But the core idea, stay put, don't spread it, was enforced. And it was often framed as, a moral duty, a community responsibility. That probably helped people accept it.
Okay, so what did they actually know about the disease itself? I mean, no microscopes, no germ theory back then. It's pretty amazing they figured anything out.
Yeah. Their understanding wasn't modern, but it was based on really careful observation, and it was surprisingly effective in practice. They definitely understood contagion. They knew that being close to sick people made others sick. Simple, but vital. They also had the miasma theory, bad air, which we know is wrong, but it actually led them to do helpful things like ventilating houses and public areas.
Hmm. Oh, interesting. So even a wrong theory could lead to a good outcome.
Sometimes, yes. And hygiene was huge. Washing hands, clothes, the body, that was already a big part of Islamic practice, so it's emphasized even more. Plus, they were meticulous about observing and recording symptoms, the swellings, the fever, those black spots. That helped them identify cases early and try to isolate them.
And did any individuals stand out in terms of their understanding?
There were several, but one really notable figure is Ibn al-Khatib from Granada in Spain. He wrote quite clearly about how disease could spread. He actually said, infection is transmitted through garments, vessels, and earrings. Think about that.
Objects, like contaminated objects spreading it.
Exactly, what we now call fomite transmission. That was an incredibly sharp observation for the 14th century. Now, apparently, he got some pushback for it. It was controversial.
I bet.
But he was right. He saw something crucial based on observation.
That's remarkable. Okay, so they have these ideas, these observations. What about the infrastructure? Did they have systems in place to actually support these public health efforts? What did daily life look like with these measures?
This is where something called the Islamic Waqf system was absolutely critical. Think of Waqf as like perpetual endowments or trusts set up often centuries before. These weren't just charities. They were designed to fund public services indefinitely. And long before the plague hit, they were funding things like hospitals.
The Bimaristan you mentioned.
Exactly. Also, public water fountains, providing soap, running public bathhouses, organizing proper burial services, even maintaining mosques and public toilets. These were established parts of the urban landscape, funded reliably, not just emergency measures thrown together.
So that creates a really stark contrast, doesn't it?
It really does. You read about some European cities at the time lacking clean water, no real central hospitals, the poor sometimes literally dying in the streets. But in a city like Cairo or Damascus, because of this Waqf system, this sort of pre-existing urban planning for public good, even the poorest people usually received a proper washing, prayer, and burial. The infrastructure wasn't invented because of the plague. It was already there. Islamic urban planning was just doing its job, and it proved incredibly valuable when the crisis hit. It turned crisis management partly into just executing existing plans, not inventing everything from scratch.
That's a fundamental difference. Now, thinking about the religious aspect again, it's easy to assume that the main religious response would just be mass prayer, right? Appealing for divine help. But it sounds like religious leaders in the Islamic world played a more practical, structured role in public health, too.
Yes, very much so. Their role often complemented the medical advice. You had religious leaders actively telling people, avoid crowds. They even issued legal rulings, fatwas, saying it was permissible to miss Friday prayers if it was for public safety. That's a big deal, considering how important congregational prayer is.
Definitely.
And they constantly repeated that prophetic advice we mentioned earlier. Don't flee plague areas, don't enter them, reinforcing that sense of staying put for the community's sake.
So it created this kind of unified message.
Exactly. It created a shared framework where the public health advice wasn't seen as conflicting with religious duty, but actually aligned with it. People accepted these measures partly because they were framed as religiously sound, even if they didn't fully grasp the medical reasons. That unity, from the pulpit to the doctor's advice, must have really helped compliance.
Okay, let's talk about the Hajj again, the pilgrimage to Mecca. It's one of the absolute pillars of Islam, a journey every capable Muslim strives to make. Restricting that, I mean, that must have been an incredibly difficult, almost unthinkable decision. Do the sources give us a sense of the gravity of that choice?
Oh, it was absolutely monumental. The sources don't always detail, the emotional debates minute by minute, but the sheer fact that they did it speaks volumes about how seriously they took the public health threat. Scholars certainly debated it, but the decision was ultimately made based on protecting lives. In some years, they actually closed the Kaaba itself, the holiest site.
Wow.
Yeah. Caravans bringing pilgrims from places like Egypt and Syria were stopped. Pilgrims were told explicitly, wait, do not come now. These weren't light decisions. They came from applying that prophetic guidance and the practical understanding they had about how disease spreads in large gatherings.
And how does that compare to, say, Europe at the time?
Well, you sometimes saw the opposite in Europe, where large religious festivals or pilgrimages continued, and sadly, sometimes became super-spreader events, unintentionally worsening the situation. The willingness to restrict the Hajj really highlights how integrated their approach was faith and pragmatic public health working together, even when it meant sacrificing, temporarily, a deeply important religious practice for the greater good.
Right, so the Black Death wasn't just one terrible event and then it was over. It kept coming back, didn't it, in waves for centuries.
Yeah.
What happened after that first huge outbreak? Did these cities keep up the response or did things slide back?
The evidence suggests they largely kept it up. These Muslim cities showed a pretty sustained and adaptive response over a long period. When the plague returned, they often went back to the same playbook. Closing markets, organizing street cleaning, maybe setting up prayer areas outside the city again. And crucially, they kept records. They noted down death tolls, symptoms, trying to learn for the next time.
So it became almost institutional knowledge.
Sort of, yeah. It was a continuous learning process. They kept referring back to the hadith, but also to the writings of the scholars and doctors from previous outbreaks. They built up this body of knowledge, these best practices that evolved. It wasn't just reacting, it was an ongoing system of trying to manage this recurring threat.
Which leads to a really important question. If this was happening, if this response was so organized, why don't we hear more about it? Why isn't this standard in our history lessons about the Black Death?
Yeah, that's the million-dollar question, isn't it? And it really points towards a significant Eurocentric bias in how history has often been written and taught. When we learn about the Black Death in the West, the narrative often focuses on Europe. The panic, the bloodletting, those plague doctors with the beaked masks, images of religious frenzy or superstition. It makes for a dramatic story.
It's a very strong image.
It is. And what often gets left out, or maybe downplayed, is this more organized, arguably more rational response happening in places like Damascus or Cairo. The idea that Muslim cities might have taken, smarter actions, that their scholars were writing calmly about transmission while doctors organized burials methodically, instead of, say, blaming minority groups or witches. That narrative can be, perhaps, uncomfortable for a purely Eurocentric view of history, one that often positions the West as the sole source of reason and progress, especially in science and public health.
So it just doesn't fit the expected story?
Pretty much. And because it doesn't fit that neat narrative, it tends to get ignored or minimized, even though it's a really significant part of the global history of pandemics.
This whole deep dive has been, really eye-opening. We've kind of pulled back a curtain on a chapter of history that deserves a lot more attention. It shows this incredibly sophisticated, organized approach to a massive global crisis. And it definitely makes you rethink some common assumptions about the past.
Absolutely. If you bring it full circle, think back to that 14th century Damascus. When death was literally stalking the streets, people didn't just descend into chaos. They drew on ancient wisdom. They listened to coordinated advice. They closed the gates. They cared for the sick and the dead. They stayed home. It shows remarkable foresight, communal responsibility, all built on this foundation of public health infrastructure and religious guidance working together.
So here's a final thought for you to take away. The word quarantine, we know it comes from the Italian word for 40, quaranta, referring to the 40-day isolation of ships in Venice, much later. But the idea behind it, the actual practice of isolation of public health measures to stop disease spread, that concept, that practice was already active, being written about in Arabic centuries, even 1,000 years earlier with the Prophet's guidance. What does that tell you about what we think we know about history and maybe what other forgotten stories are still out there, waiting to be rediscovered?